Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers podcast, and we have a guest again today. Her name is Dr. Meg Mill. She's a functional medicine practitioner and a doctor of pharmacy. And we brought her onto the podcast today. We're going to do a little bit more in-depth discussion on something that a lot of people struggle with, and that's headaches and migraines. We'll kind of talk about the difference between those things, what are maybe some of the main things contributing to headaches and migraines, and maybe what the challenges and the problems with treating migraines is versus maybe addressing the cause of what migraines are. So without any further ado, Meg, welcome to the Thyroid Answers podcast. How are you today?
Great. Thank you so much for having me.
So I you've got a great bio, the author, podcast person. You've been in this space for years, but give the listeners a bit more of a background about Dr. Meg Mill is and why we should listen to her.
Yes. Well, I think many of us have a personal journey. So mine actually, started with my own journey. And when I was about 33 years old, I had three little kids and like a 2 year old at the time. And I started getting panic attacks. And it had been building up for me, like all of these health issues where I had had the GI issues, I'd had the headaches, I'd had allergies. I was getting to like at the point I couldn't even eat. But it was that moment, it was actually when the anxiety came up and I was dealing with all of the other things, but I started getting panic attacks sometimes when I would sleep. And so we can talk actually even about why that can start to happen physiologically. It's so interesting when you put all the pieces together. But that was the moment for me that was like a turning point. I have to make some changes. And so I knew I hadn't been getting answers. I'd been doctor shopping and been told like, you're fine, you're so healthy. And here I am in medicine and can't get the answers. And so I knew there had to be a different way. And I really dove into all of the information on really putting the connections together. And that's when I found functional medicine. So it wasn't until I found functional medicine that I started to finally feel better. Just like everything started clearing up because we're looking at all the connections and everything I was experiencing. I didn't feel like it was connected, but it was. And so I really wanted to share this with people because I'm like, I can't believe the health transformation that I couldn't get before that now I feel. And so I opened a functional medicine. I went back and got certified in functional medicine, opened up a virtual practice, and I started seeing hundreds of people come in. And one of the things, and why we're talking about headaches and migraines today, that I started to see as a pattern that people were either coming to me with for headaches or these hormone, a lot of times even they call them hormonal migraines. We can talk about why that happened, or they were normalizing it. So it would be like, oh, I'm coming for GI issues, and then we do this detailed intake questionnaire, and yeah, but I have headaches once a week, or I have headaches twice a week, and oh yeah, everyone in my family does. It's just something. And I realized, wow, this is so normalized and you don't have to. And once we start addressing these things, everything changes, everything clears up, and it's life changing. And so I think I'd like to get the message out there that you don't have to live with headaches, even severe daily migraines. We've seen them go, they can clear up. And I think that message isn't told to people enough.
Well, what's interesting, and for the listeners, if you didn't catch it at the beginning, Meg within pharmacy, right? Which is the person who's like doling out the prescriptions that
Yeah.
are written by your primary care physician. So as you're having a lot of that symptomatology, you're obviously you've got all the options right in front of you as a pharmacist. Like, what did you find? Like, where did the real disconnect come in from for you between, hey, I've got all these things going on. I got these GI issues, anxiety. I've got the prescriptions right here. Like, at what point were you doing those things and they were working, or that you were doing these things and you weren't working? What was the thing that led you to go, okay, I need a different strategy? Because what you're saying is going from the pharmaceutical world to functional medicine's like, yeah,
It's a big
that's a
change.
big change.
It is, yeah. So, I did a residency after pharmacy, after getting my doctorate. And during that time, was sort of when I got a lot of the symptoms. So we're talking, these symptoms were kind of happening over about ten years. So I was trying, then I was trying the different drugs. I was trying things and nothing was working. It was like, I went to 5 different gastroenterologists and we moved. So it wasn't like, oh, I'm just going around town, but we moved a lot at that time. And I would move to like, okay, maybe I'm going to get the answers here. Like maybe I'll get somebody to actually help me, but I just wasn't feeling better. And I
Hmm.
got told, like so many of you, I know you're listening, and got told, you're fine, everything looks great, and you feel terrible. And I think that
Hmm.
was the biggest thing for me, is being told, here, I have access, I tried the medications, I understood how and why they were supposed to work, and I know what's wrong with me as far as like, they're looking at, but I never felt good. And so it was like, there's this disconnect of you're good and you feel terrible. And I just could never get the answer. So I think that's really was like, there's something wrong. We need
Right.
to look at this in a different way.
Yeah. And so it can be, and I think we've talked about this before, the challenge becomes like the paradigm, right? When you're in an allopathic model, you're really thinking about, all right, what's the diagnosis that I can manage or treat
Mhm.
versus what functional medicine should be, which is, all right, I got to dig in here and try and figure out what's causing the the symptom or the complaint, right? And so neither one of those is bad, right? Like if you're
Yes.
dying of a migraine, you were like, I don't right now, I don't care what the cause is,
Yeah,
right?
I
Right
agree.
now, I want something to get rid of that. But did you find it, and it doesn't sound like it, but did you have difficulty shifting from here's a prescription to not necessarily that you're doing that, but here's the prescription to manage migraines, right? Here's the
Mhm.
prescription for this symptom or condition versus what we should be doing in functional medicine, and not everybody does, but in saying, all right, I'm not going to switch. I'm not coming to functional medicine and then going to say, what are the supplements to manage migraines or headaches, but what's addressing the cause?
That is a good point. So you're bringing up a point here of like, okay, yeah, we're going to just switch out prescriptions for supplements and
Hmm.
not address the root cause. And that does happen. So yes, now I get asked when you're saying this, I get asked all the time, if I have a terrible migraine, like what should I do? And at that point, I would say, take the medicine. If you're at that point where you're literally not functioning and you can't do anything and you have a rescue, I'm not asking you to be in pain and say, okay, I would never do that. And I think that's what's a little bit maybe different about me, is that I know where both fit in. And I'm not going to say suffer. However, I always say our point is so that you never have to get there. And that's what we're working on, to not get there and put all these pieces together. And when we do, we just see that happen over and over. It's truly amazing, because it is such a, really that pain. I mean, the pain that you can't do anything, you can't plan your life. To be able to see that turn around, it's really quite remarkable. But we just need to look at the place. And the allopathic side is great for acute care. So when you have that acute situation, there, you're getting that solved. I mean, I had to take my daughter, cut her hand and needed stitches, and it was like we got right in there. That was, it was addressed. Or, when you have those things, you need that. But it's what these chronic things that we're looking, it's just a band-aid approach. So an analogy that I like to use with this is, someone said this to me a long time ago. I think it's kind of funny. If you took your car to a mechanic and you took it in and you say, my car's making a funny noise, and the mechanic took your keys and walked over and checked your car and then came back and handed you a pair of earmuffs and in your keys back, and we're like, here you go, your car is fixed. You'd be like, I'm not driving this. I'm not going to go out, and that you didn't solve the problem. And that's the typical band-aid approach that we're doing when it comes to headaches and migraines. It's okay, the foothold is addressing the pain. What are we going to do to address the pain? Not what are we going to do to really help solve this problem?
Yeah. And that, I think, to a large degree, that's the difference maybe between the allopathic and what should be a functional approach. Although I do see a lot of people in functional medicine try and do the same thing with supplements, right? Like,
Mhm.
hey, you just need to take this, right? And then just take that every day. That's still allopathic medicine with a supplement. Again, symptom management. Neither one of us has a problem with that. If you're in crisis mode,
Mhm.
you know, deal with the crisis, right? Um,
Yes.
but ultimately, what we want to think about from a functional medicine perspective is what's driving that. Because I often look at the sign or symptom as the adaptive response to something,
Hmm.
right? And we
Yes.
say, oh, it's bad. Well, that's your brain saying, whoa, here's this is creating a response. This is creating a sense of irritation or threat or problem to the system. And because of that, we get this type of symptomatic response. Sure, we can suppress it, but really we want to do is, yeah, what's causing this? And if I address the cause, then maybe I never get another migraine again, right?
Hmm.
That's
Yes.
really what we should be doing. So let's talk about migraines. What and when you're seeing when somebody's coming to see you with migraines, I guess let's start with this. Headache, migraine. What's the difference?
Okay, so a tension headache is the most common headache. And a lot of times you're going to have like that's more that dull band across your forehead. It can affect, sometimes we get that from the back of our neck too, where we're getting that stem from neck tension, and it usually affects both sides of your head. You typically, when you have a headache, there's not a pattern to it. So it doesn't necessarily last a long time. You're not seeing, we'll talk a little bit more about the patterns that you see with migraine. So that's probably the most common thing. And even if even if you've never been diagnosed with migraines, if you're getting headaches all the time, that's still a problem. So I feel like we discount like, oh, I'm a migrainer versus I have a headache. Oh, I don't have a problem because I don't have migraines, or no one ever put that label on me. But nobody wants to have that either and have the drugs that you have to take for the pain. So, we don't want to discount that. But that's kind of like the traditional tension headache. And then migraines are more categorized as more of like a throbbing, intense pain. It can be really debilitating. It often will affect like one half. It can be on both sides, but often we'll see that like one side, maybe behind the temple, where you're really getting that intense pain. And those headaches usually, type of headaches usually last 4 to 48 hours and can last up to 72, or I have actually even seen longer. So we're looking at this longer headache. We look at you usually have sensitivity to light, noise, movement. So with a migraine, you often feel better if you lay down, if you dim the light, if maybe put a cloth on your forehead, some of those things. Sometimes you can get blurry vision, you can have nausea and vomiting, you can have an aura. So that will be a neurological disturbance that will actually affect your vision, sometimes your smell and your taste. And then you get the head, so that usually goes the aura, the headache, and then you can have like a postdrome where you're really tired after and even feel like a little bit of a hungover effect. So we usually see that they're more of that pattern, and maybe a longer term also when it comes to migraines.
So if we're thinking, or some more simplistic way to maybe say it, headaches, so head pain, some discomfort, maybe shorter term, maybe not as intense, maybe not as
Mhm.
debilitating. Once you're getting into more severe, more intense, more debilitating, maybe we're kind of shifting into what we might identify as a migraine. And for the listener, like you could do two podcasts on just all the different types
Yes,
of
I know. Yeah,
headaches,
you're right.
all the different types of
Yeah,
migraines. So
yeah,
just trying to make it
yeah. And
real more simplistic.
to me, it doesn't matter. When I'm working with people, I don't like, because people will say, well, what about headache? Yeah, there's like a big distinction, but we need to do the same things either way. So we're
You
working on putting the pieces together. So if you have either one, it's going to help you.
Yeah. And you're kind of jumping the gun because that's exactly what I was going to start to say. Like the next question is there specific things that we say, oh, these are triggers for migraines, these are triggers for headaches, or it really the triggers could all be the same, but it's really about how the individual's physiology responds to those triggers. What would you say for that?
Yeah, so I would say kind of like both. I know that's a weird answer, but so, we're going to look at hormonally, generally that's more of a migraine. So when you're getting those but it's hard, it's a distinct the characteristics of what's distinguishing the difference is sort of just labels in some ways. I mean, we don't have like a blood test that says migraine versus just headache. We're looking at symptomatology. So yes, I think that it's really just patterns and symptoms that we're looking at. Some of the typical things that we would say typically cause a migraine might be different than the patterns that would cause a tension headache, but overall, a lot of them are overlapping, and we want to look at you as a whole. I really want to look at you as a whole person anyway. So let's say hormones can go be more stimulating for migraines, but if you get headaches, it doesn't mean that we don't want to look at your hormones because they could be affecting you too. So I think it's just really looking at that whole person and the whole picture.
Yeah, I think it really sure for sure. My sex hormones you can see more triggering there, but it's something as simple as gut issues. I mean, I have one of my kids is, if he's exposed to gluten, he's
Hmm.
it's gonna trigger a migraine. So,
Hmm.
is that hormonal or is that just is it
Oh,
how
that's no,
his
no, no. That was just one thing that I
right?
was
No,
like
no.
thinking, particularly when
Oh yeah,
people
yeah,
consider like I have hormonal migraines.
yeah,
That's a thing that people think of.
right. But I think for the listener, the important part of that is like, and Meg said this at this, couple minutes ago, which is really we got to figure out. It doesn't really matter so much what the name of that
Hmm.
somebody's given it. That really only matters in a model where you're treating the diagnosis. Oh, if that's a tension headache, we might give you this. If it's a migraine, we might prescribe this because you're treating potentially the diagnosis. In functional medicine, we're not treating the
Hmm.
diagnosis. We're saying, that's okay. You have headaches. Oh, they told you have migraines. Oh, they told you have irritable bowel. They told you they have this. Okay, good. Let's get back to what's creating this self-stress response that's causing these chemicals to be released and resulting in this type of response in your body. So, what are those things that you typically see as maybe some of the more common drivers of these headache, migraine driven type symptoms?
Hmm. Yeah, one day I actually wrote a list, out because I'm thinking it's like puzzle piecing. We almost become detectives, and there's almost 50 different connections that we're looking together. But let's start with some of the basics, and I want to start with food actually, because food can be really complicated when we're talking about headaches. There's different buckets of things that we look at with food. So the first one that you were mentioning that your son has are food sensitivities. And so these are unique to each person. So we're going to get an IgG antibody response. So when you have the leaky gut, you start to get the food going through the gut lining at bigger particles, your immune system says, "Oh no, we don't want to see this," and you start getting this inflammation. And that's when you start getting I'm very simple simplifying
Mhm.
it here, but that's when you start to get the food sensitivities. Now, this is tricky because I have run actually programs. I have a program called Headstrong. So in addition to seeing private clients, I've actually worked in this group program format for migraines. And when we get all these test results, they're so interesting because we'll do a food sensitivity test. And one story, I'm just going to share this because it's really stood out to the group and really is something that people want to think about. So one of the people in this group was actually eating pea protein because dairy and gluten are common food sensitivities. So we're educated now. We know that. And so she was thinking, okay, I don't want to have dairy. I'm having these migraines. I might have a food sensitivity to dairy. So she was actually doing pea protein, like a vegan protein. But when we did her food sensitivity test, peas were her highest food sensitivity. So here she's doing something to actually try to better her health, to think that she's doing something right, and even switching from that pea protein to back to her whey protein in her case really significantly helped her migraines. And so I think that's one of those interesting stories that we're like, okay, we're all unique, where we often will bucket like, okay, this is what you do, but everyone's a little bit different.
So let's break that down a little bit because somebody there's there it's the kind of a controversial subject when we talk about food sensitivity and food
Mhm.
testing and why somebody's reacting to things. Um, One of the keys I think that happens, and I'll get your take on this. We might have talked about this before, um, is that when we do food sensitivity testing early on somebody, and everybody's got opinions as to what to do,
Mhm.
but it's not unusual from what I've seen that people will be reactive to the things that they're consuming the most. And so I'm a little bit leery to do food reactivity testing on somebody early on because if they're consuming a lot of, let's say, pea protein and they have permeability issues in their GI tract, yeah, they might have reactivity to it. So now they switch from pea protein to whey protein. Hey, I feel better. But then because of that permeability issue, now they start saying, well, now I'm reacting to the whey too,
Yes.
right? And
Yep.
so do you see that as well? And when do you think? Because I know people will listen to this and go, oh, I get headaches. I'll go do a food sensitivity test, just hearing this conversation, and they'll spend that money and go, oh my gosh, I'm reacting to 30 foods. I have to eliminate all of these. And now they're down to, 20 foods. And now they're like, oh, in time, now I'm reacting to these foods. And now they're down to 3 foods before you know it. So what's your thought process on that piece of it?
That's a great point. So I have two things there. So exactly what you're saying. So we are also working on the gut permeability. So yes, you want to be doing that because if you're just pulling foods out and you're not doing the gut healing work, then you're like exactly what you said. You're just going to start reacting to new foods and we're just going to switch those reactions. So that's a great point. You want to make sure that you are working with someone who you're doing a gut protocol with at the same time. I don't actually do food sensitivity tests with everyone I work with, but I do find them while we're working in this process. If you're putting them in the right place, they can be very informative for people that have the headaches and migraine, just because there is such a really big connection with some of these food reactions, but you have to be putting them in the right place. The second thing I want to bring up is that not all food sensitivities are the same, tests are the same. And I have done multiple side by side comparisons because I think there's a lot of maybe inexpensive tests out there that say, oh, yeah, we have all the answers. And they come back with these long lists of foods that you have to avoid. And you may not be sensitive to all of them. So I do see there's a lot of tests that have false positives and then you feel so limited. So you also want to make sure that you're getting a reputable one from someone who recommends, that maybe a practitioner that can advise you, because I would just say that not all food sensitivity tests are the same.
Yeah, I think there's a couple key points there. I agree with you. It's not that I'm opposed to the food reactivity panels, but I think timing might be important, and it's
Mhm.
specific to the individual. If somebody is, they've done anti-inflammatory gut protocols, they're eating, and they brought a whole bunch of foods back, but they're still reacting, they can't figure it out. That may be a helpful situation. If somebody's at the starting point, like I've been eating a standard American diet, I haven't done any gut work. Should I do a food sensitivity test? No. How about we just try like an AIP type diet, like a whole food based diet? Let's get the crap out of there. Let's see how we do there, right? Let's not spend $600 on a test. The other thing that's really important, and the type of testing is important, and I won't put you on the spot to ask you which companies you really like. I thought about doing it, but I won't put you on the spot. Um, but there is a difference, right? In some of these companies, and I think for the listener, what happens a lot of times is you get the tests back. There's permeability issues. Our body is designed to have food come in it, but if we have undigested foods crossing the barrier, undigested food peptides or proteins crossing the barrier on a consistent basis, that's going to start to trigger immune reactivity. It can also trigger something, and I'll let you kind of jump in when I just finish this point, is that there's something that can also occur, and it's called polyreactivity, meaning that when there's chronic immune inflammatory processes going on, we now start pumping out like immune cells that are, and these antibodies that aren't specific. And they've got multiple kind of attachment points, and they can kind of bind to react to almost anything, right? And so is this good or bad? This is like the immune system going like, I don't know what it is, but I'm going to put out like the first model of the iPhone and we're going to see how that goes. Right. And so these antibodies are like, they can respond to anything. So they may not really necessarily be responding to things necessarily everything in you, but definitely when we put them into a tube or a dish or a plate with something, if we have polyreactive antibodies, you may see like everything on my food reactivity panel is positive. Yeah, that's not true reactivity. You've got these polyreactive antibodies going on and they're responding to whatever's going in there. Have you seen that and you're familiar with that as well?
Yes, yeah, you have to, I know, and that's again why working with someone who is guiding you through the process is good because I think that I've had people bring lists to me like that where it's like every, now I can't eat anything and it's like, okay, wait, we need to unpack this and really go through what's actually going on.
Yeah. And so that's really important. And because if you don't realize there's polyreactivity going on, then you might say, oh my gosh, I'm reactive to 179 of the 180 foods tested here. You
Yeah.
probably are not. That's probably not necessarily what's going on. There are probably some things hidden in there that you're having more reactivity to, but
Mhm.
it's not specific there. And I will tell you this, so because I don't want you to be put on the carpet, but there are some labs that when they are testing for food reactivity, they're testing maybe just raw, not raw versus cooked. And,
Yes.
and that can make a
Hmm.
difference because when we cook food, we change the protein structure and or the amino acid structure. And so it could be a totally different food. So you could have reactivity to an uncooked food and maybe not have reactivity to a cooked food. So some of the companies will actually do raw and cooked, which I think adds another layer to the complexity. And I think the third thing that I have seen that I like is that there's some companies that have also looked at common cross reactivities. So if you react to, let's say, almonds, hey, here's like
Yes.
six other things that may cross react because somebody might get that done. Like, I don't even eat almonds. How can that be?
Yes, I
Well,
had that too.
right? So if
Yes.
they're reacting to, let's say, hazelnuts, and hazelnuts
Yes.
could, if you make an antibody to hazelnuts, that same antibody could react to the almonds, even though you're not eating them.
Hmm.
You've seen that as well?
Yeah. Yeah, and one of the ones that I find interesting is wheat and coffee.
Hmm.
So sometimes there's the cross reactivity between those, and people are like, I don't drink coffee, like I'm never around coffee. And so sometimes you're like, okay, there can be that cross reactivity. So it can be confusing for sure.
So for the listen, I want you to make sure you get this key point. Like if you are listening to this and saying, well, maybe I should do food sensitivity, food reactivity testing, make sure you're working with somebody who knows these tests well, knows about these things that we talked about, cross reactivity, permeability issues, and don't just go out and spend money on one of these tests because it's probably not going to work out well without some guidance. Okay, that's
Yes.
my pitch.
Hmm.
But
Yes.
so we talk about the gut, we talk about
Yes.
foods can trigger
Yes.
headaches, migraines. How does the food, can you kind of simply talk about how that might trigger a headache or migraine or other symptoms when we have food reactivity?
Yeah, so we actually even before we get that we have more foods. So we have the food sensitivities, and
Hmm.
then we also have another bucket of foods when it comes to
Okay.
headaches because there's also foods that we know will actually stimulate headaches for some. Like there's a lot of data around certain foods that stimulate headaches for some people. And where this gets very, and I'll go through them, so I'm not gonna leave
Hmm.
you hanging, but where it gets confusing is we're also looking at thresholds when we're thinking about these foods. So it can be not just a specific food, but it can be a combination of foods. So sometimes you may react, you may say, so this is a common thing. So sometimes people will say, okay, well, I can have wine because wine is high in histamine, it's high in tyramine, so we'll get into that. But sometimes people say, well, it's not wine because I can have wine sometimes and I don't have a migraine, but then the another time I drink it, I have a terrible migraine. But it
Hmm.
must not be that because it's not every time. And that could be because your threshold is different at different times. So maybe you had that wine with some aged cheese. Maybe it's the amount you had. Maybe it's the time of the month when your estrogen was higher and so it was stimulating your mast cells more. And there's all these different things that are happening in your body. And so you really need to become a detective. I say we become detectives. I have all these methods to really pinpoint these foods, but when someone can figure out what foods they're reacting to and what threshold, we look at these in combinations, it's just eye-opening. So I'll get into some of them. So we're talking about histamine foods. So we're talking about things like fermented foods, aged cheeses. We can even think of avocado, like we're going to say some healthy foods like avocado, strawberries, tomatoes. Those can all cause histamine issues. And then we're looking at tyramine containing foods. So tyramine, its foods are again aged and cured foods. So they can actually, they're known to trigger migraines by releasing hormones that constrict your blood vessels. So we can have some issues there. We have salicylate, so that's citrus fruit. So things like lemons can be bothersome. So things that you might be, you might be having lemon water in the morning for health and detoxification, and that could actually be triggering you. We have nitrates, which are that you can find like hot dogs, bacon. Sometimes sulfites can trigger people. That could be dried foods, wines, MSG, which is in canned foods, soup, processed meat, aspartame from diet soda, and then we even a lot of artificial flavorings and different colors and additives. I mean, that's kind of like, we should just avoid those anyway. But when we're looking at these food lists, you're seeing, okay, some of them are healthy foods. There's a lot of different types of foods. And so you really want to start looking at this variety. So when I'm working with someone on this, I know food journals can be cumbersome for people to write down all your foods all the time. So what we do is we actually say, if you have had a migraine or a headache, write down what you've eaten in the last 48 hours. So we just, like, when it occurs, we document it, and then we start to look for patterns. So we'll look at, okay, what foods have you eaten? Did you not sleep as well? Were you dehydrated? Were you stressed? We'll talk about some of these too, but what are the other factors? And then we start to form patterns. And once we do, it's so enlightening, things that just show up for people.
Yeah. And I think that's essentially what we're talking about is the load, right?
Yeah.
Like,
Hmm.
what are all the things that are contributing to a load that might trigger more uh, challenge with maybe detoxification pathways, metabolism pathways, inflammatory molecules being released, versus a thing. I mean, you're talking about foods with histamine, like every meat
Yeah. You have to
substance
watch
has histidine,
leftovers.
right? And
Mhm.
so if you
Yes.
have, if you, as you're, if you're breaking these things down, and you should be able to break these things down. I mean, if you're not be able to break these things down well, and their triggering response, um, it's not necessarily that all these foods are terrible foods. It could just be for you because, hey, I've got, because of these other stressors, I've got vitamin deficiencies. Because of the dysbiosis in my GI tract, I don't produce thiamine oxidase to help break down histamine, right? There's a number of other things that can go into the picture versus I just I just have to eliminate or just have to remove it, right?
And that's a great point. These are not, when we're doing this, it's totally discovery. It is not like you should not be eliminating these long term. So you're finding your triggers as you're doing the gut health work to create, more diamine oxidase, to figure out why you're having histamine intolerance, to figure out what, all of the other things at the same time. So it's kind of this, there's different approaches that we're doing simultaneously. So when we're looking at the triggers, it's really more for an identification purpose. It's not a long-term diet. I think that that's really important because people get so hung up on the diet. When we're talking, when we're, especially with a low histamine diet. So you get so hung up on, oh, this food and this food, I'm going to react to this food. And, and I totally understand that because you're reacting and you're scared. You become scared of the food because you're
Mhm.
reacting to this food and it's like, oh, did I have this? Did I not have this? Um, but that it's not really, again, when we're talking about functional medicine, when we're talking about band-aiding with supplements, you don't want to band-aid with the diet either. The diet is for investigation while you're working on the other things and bringing everything back into balance so that you can navigate a full diet in a way that works for you.
Yeah. And histamine's a great example because so many people, I mean, there's websites, just lots and lots of websites dedicated to a low histamine diet, histamine intolerance. Everybody's talking about their mast cell activation syndrome and excessive histamine response. So, and if you just avoid it, right, I'll just avoid histamine, then you haven't addressed why am I struggling to break down the histamine in these foods, or why are these foods triggering it and I can't manage it. Eliminating those foods, which is really difficult to do, doesn't solve the root issue. It's a
Yeah.
short-term strategy, but ultimately a really hard place to live on a constant basis. And I think to some degree, it contributes to the food fear that contributes to more stress and more
Hmm.
dysregulation, especially of the gut and the nervous system and immune system. That's going to set the stage for probably more
Yes.
food-driven issues,
If you
right?
have a histamine issue, you really have a gut issue, a methylation issue, or a mast cell activation. So, it's really, we have to look at those things in order to bring it back into balance while you're investigating. You really have to you have to work on gut health if
Mhm.
if you're having these histamine issues.
Yeah, and I think to tie this into from a thyroid perspective, we think that sometimes people think about histamine, they think it's just these mast cells that are dumping, or they're
Hmm.
only their mast cells that are creating histamine issues, and that mast cells are bad. Well, the mast cells are doing what they're kind of being
Yeah.
directed to do to protect,
Yeah.
but it's not just mast cells that release histamine. Almost every
Hmm.
cell has the ability to release histamine. And what's interesting from a thyroid perspective is if you have hypothyroidism, let's say impacting the gut, your immune cells and mast cells too can come to that area to help deal with whatever the threat is. But if there's a threat response in the gut, inflammatory mechanisms, you're going to get decreased conversion of T4 to T3, so you get some downregulation. But these immune cells that are coming in to help, they're also in their vesicles inside them where they have the histamine, there's also thyroid hormone stored in those. And
Hmm.
so in an effort to maybe help with the threat, they're also releasing thyroid hormone, maybe in a supporting role. So it's not unusual that some people who have hypothyroidism have a little bit more histamine type responses, maybe not as a problem, but maybe it's an adaptive response by the immune system to potentially help support a local tissue. I don't know. It's talked about in the literature.
Hmm.
The other thing
Yeah.
is that excessive thyroid hormone activates mast cell degranulation. And I think there's the literature seems to show that maybe 60 to 90% of the population who's taking thyroid medication is inappropriately prescribed, which may trigger chronic histamine responses in a lot of people. I see that a lot with people who
Hmm.
come to me for help. They're like, I've got skin issues, I got histamine issues, I got rash issues, I got this. Yeah, you're also over medicated. So let's start weaning down on that thyroid medication. I don't think you probably would need to be. You could have probably never been at this dose, and you probably some of these people never should have been on it to begin with. And then as you start decreasing the dose, like, hey, my headaches, my migraines, my skin issues, like this is all clearing up. What is it? I'm like, you were over activating this hyper thyroid state that you were creating with your medication was probably activating your mast cells to degranulate. Probably not a great place to be. So we can actually
Yes.
create this problem too.
That's really an interesting point because you're just, when we're looking at all these pieces, you're just bringing up another great point of it can be medication, I mean, where it can be something like that. And that's where there's so many factors. Sometimes it's really hard to identify, but that's true. So, going downstream, you're activating the mast cell relief, you have an increased histamine response. Histamine's one of the reasons that we get headaches because we have histamine receptors all over our body. And so it's just this work of putting all of these connections together. So I Love
And
that.
it's why people can go down rabbit holes and they get lost,
Yes.
because it's hard to,
Hmm.
even for those of us who do this on a regular basis, like it's not the unique thing about functional medicine is like sometimes be like, what do you specialize in? I don't specialize in anything, because you really need to know, how does the gut
Hmm.
tie to sex hormones? How does that relate to brain function and neurotransmitters? And how does all of this stuff tie together? So we really do need to be a jack of all trades. But sometimes if somebody's just really focused on one thing and they're driving down that pathway, they're not realizing how all these other components are contributing to what they're trying to fix. So they try these strategies to fix the headache or fix the migraine, but it's really, they don't realize the impact, why that treatment may not work, or how that treatment may manage a symptom but then create problems somewhere else that then contributes to more of the very same sign and symptom.
Hmm.
So
Yes.
I don't want to get off in the weeds too much. So we talked
Yeah.
about gut, and if food can be a trigger for headaches, migraines, what else can be common trigger for headaches and migraines?
So let's just start going back to the basics too, and then we can get into more
Hmm.
detailed ones. But dehydration. So are you drinking enough water? And so we want to make sure that we're hydrated actually at a cellular level. So two things that you want to check, like, are you drinking enough water, and how are you drinking your water? Are you just chugging it like, oh wait, I didn't drink my water, I'm going to go chug it, drinking it at meal times? We want to actually sip our water throughout the day so that we're really getting that absorption at that cellular level. We're not just eliminating. If you drink too much at once, sometimes you're just eliminating what your body can't use at that time. And then even potentially adding some electrolytes in can be. Now, I'm going to actually preface this, adding some electrolytes can be good. There are a lot of, there's a citric acid in a lot of electrolytes, and citric acid can be sometimes a problem for people with headaches. So you just want to also look, I feel like there's always prefaces. You want to look at what you're taking, and make sure you're getting the right electrolyte. But that's even really adding that in to maybe one of your drinks a day, just to make sure you're really staying hydrated, because dehydration is actually an independent risk factor for having a headache.
Yeah. So, like, there's a lot of discussion about, how much water do we need to drink? Like, so what would be your general recommendation from a hydration standpoint? Like, how much water does somebody need to drink, and
I
versus
usually,
their food? Like, how do you figure
mhm.
out what that should look like?
I really just try to say, just generally, like, aim to drink about half your body weight in ounces of water daily is kind of the general guideline that I give to people. I mean, we don't necessarily have like specific targets. And sometimes you can, there's an intuitiveness too, like, how are you feeling, and what do you feel, are you feeling symptoms, are you feeling, what are we doing? But that's kind of just a broad guideline that I use. How about you?
I think that's a good place to start. Um, and the challenge becomes, is the water we drink truly hydrate the cells and the tissues the way we think they should? And I don't know. There's a
Mhm.
discussion between filtering water and natural water, and I don't know. We need to go into the full details of that, but there is some discussion that when we drink a lot of filtered water in an effort to try and clean it or purify it, right, that we break down the structure of water, and it loses some of its ability to get into the cells and tissues and be as usable when we break that down. How accurate is, I don't know. There's books out there. I think the fourth phase of water is one of those, but there's there's some discussions about that. So there's people that drink lots of water and they still continue to feel dehydrated. And maybe part of that is because they're drinking a lot of filtered water, not maybe water in its natural state. And so they're not getting the full benefit of it. The other thing I think that's really important is that we got to make sure that we're actually, I think one of the biggest ways we get cellular water is through the appropriate production of cellular energy. So when we take food energy and convert it to cellular energy, the byproduct of making cellular energy, something we call ATP, is water. So if you
Mhm.
drink a lot of water, but you continue to have signs and symptoms of dehydration, um, then we have to start to ask question, is it, hey, I'm just peeing all this stuff out, and I'm not able to use it. So what type of water am I drinking? Is it because I'm drinking a lot of this excessive amounts of water and I'm losing a lot of micronutrients with it, and that's creating problems? Or is it that, you know what, I don't have great cellular health, and because I don't do a good job of converting food energy to cellular energy, I can't hydrate my cells really well, no matter how much water I drink. And for
Yeah.
the listeners, when you think about water, this is kind of a weird thing, but think of water that it has structure. Most of us look at water like it's just this stuff that we pour around. But if we looked at it like in depth, it has a structure to it. And it's thought that when we filter it, we kind of break it down. So I talk about, like, if you had a Lego's Millennium Falcon, right, from Star Wars, and it got dirty and you gave it back to me to clean, like, hey, can you clean this? And I took it all apart and washed it and just gave Meg back a bag of Legos, could be like, what am I supposed to do with that? Like, that's your Millennium Falcon. It's lost its functionality, right? I cleaned it. I did what you asked me to do, but I didn't put it back in its normal form. In the body, it's thought that if we're drinking this kind of water that's lost its structure, now the body has to put energy into rebuilding that structure, and energy that we may not make very well. And that may be one of the reasons why we don't uh, get the same effects in people when they drink copious amounts of water.
Mhm.
You can comment on that if you want.
Yeah, it's an interesting topic. I actually had someone I was working with a few years ago who was a mineralist. And
Hmm.
so it was just, we had such an interesting conversation in his appointment, really in depthly about the way to drink water, because his wife was there too. So it was like the three of us they were talking about how they disagree of what he thinks that you should have versus what she'll drink. And then,
Hmm.
what's in our tap water and, versus but you're right. The trick is to be able to drink the water without pulling all the minerals and all the good things out, but also not getting the chemicals that are put in our tap water. It's a tricky thing. I mean, like so many things in our world today, it's a tricky topic. And I don't know that there's a right answer. It was just such an interesting conversation from different perspectives and coming through, because there's not necessarily there's different opinions, and it's hard because you don't, what's in our tap water. And so people are making that effort, but then what are we doing to the water when we do? So
Yeah. And so, yeah, for the listeners going, like, where did we go with this
yeah,
conversation
I
on this
know we're
piece?
at
Like,
headaches. We're
so
talking about
I,
water.
so when we're talking about hydration, I think for me, the easy answer would be, yeah, start with about 50% of your body weight in water. Drink
Yeah.
natural spring water if you can.
Yes.
I think one podcast with Dr. Kelly Halderman, we talked about, if you go, you can Google where's natural springs near me, which is what I kind of grew up, out of the side of the
Yes.
Appalachian Mountains was pipes coming out, and water would, we'd go up there with jugs and fill them up, and that's naturally filtered water, really pretty clean. And you can find where some of these things are. Um, but if you're going to filter water, you probably, depending on how you're filtering it, there is some technology back out there. If you believe in the structure versus non-structured, you can get some of these devices to help restructure the water. Um, but if you're I would say if you're consuming like more than 50% of your body weight in ounces of water, and you're still perceiving thirst, and you're still and maybe that's what's triggering your headache, more is probably not the answer. The answer should then be what's going on with what I'm drinking, or how I'm utilizing that water in the body. Something must be compromised there.
Hmm. Yes, absolutely.
All right, so we
So we
talk
should
about
probably,
water,
yeah, I was gonna
right?
say,
We
should
talk
we
about
move
food.
into
What's next?
hormones? Should we
Yeah, let's do
everybody
it.
wants to know about hormones, the
Hmm.
hormonal migraines. So, the most common challenge we see when we're talking about hormones and migraines are either our estrogen dominance, or when we see a rapid change in hormones. So sometimes like the ovulation period when your estrogen's going up fast, and then we get that drop. So, um, it's a little bit tricky. So it's interesting, just having worked with so many hundreds of people on this. estrogen dominance when it comes to headaches. We don't know. So I'm wiggling around what I'm saying. So it's not always high levels of estrogen. And so I think that when we're talking about estrogen dominance, we're thinking about these estrogen levels that are off the chart, and why are we getting, get such high levels of estrogen? And so we have to look at, when we're talking about this, what's going on in the body once again. And sometimes we do. Sometimes your body just has high levels of estrogen. Sometimes you have low levels of progesterone. So we need progesterone to balance out that estrogen and really create that balance. And then another thing, and I am going to throw out the tests that I use here, because it does matter when we're talking about this and hormone tests. I use the Dutch test for when I'm working with people with migraines and checking their hormones, because you also have to think about the way you're metabolizing the estrogen. So one of the things that when we're talking about estrogen, you want to use it and lose it. You want to have enough estrogen that you're having, good brain function, that it's helping your bones, that you're having, not having hot flashes, that you're having all the things we need. But you also want to be able to metabolize that estrogen out of your body. And sometimes what I commonly see is that we're not metabolizing estrogen correctly. So you may actually have lower levels of estrogen, but it's getting stuck. I often see there's a metabolite called the 16-OH metabolite. We could get into the dynamics of the metabolites, but it's pretty complicated. But this particular metabolite is very commonly associated with people who have migraines, just actually from my clinical experience of looking at these tests over and over again. So sometimes it's really about looking at shifting the pathways, working on liver health. Again, we're going back to gut health, even, because you have to, really look at the gut too when you're metabolizing estrogen, but make sure that your estrogen metabolism is optimized so that we can actually process this out. And that can make a major difference when we're looking at these hormonal migraines.
So where do you see is the kind of the mechanism of why the estrogens would cause headaches or migraines? Is there something you see that you're like, okay, the reason that's probably creating headache or a migraine is because of X?
Yeah, so estrogen dominance, like that actually can increase the release of prostaglandins. So, and sometimes we see common, like a headache is a common symptom of a surge of prostaglandin. So that's one of the things that we see. So, we see also, things can be inflammatory. It's complicated because there's a lot of different things that are going on, but that's one of the things that one of the reasons that we're seeing. But it's generally, yeah, it's hard because this is very common. I mean, there's a lot of women that are having these hormonal migraines and have just felt like normal, that they have to live with them for years and years and years.
So do you think it's that, because we talk about like, people think estrogen dominance, they think they have massive amounts of estrogen. I don't think it's necessarily, there are some people that have excessive amounts of estrogen, but for a lot of people, like when we're younger, not
Hmm.
we, but when women tend to be younger, they have lots of estrogen in circulation, right? And
Hmm.
as they get older, they have less estrogen, but they can still have an imbalance between the estrogen and progesterone. And maybe the elevation of estrogen, if it's that's driving up prostaglandins, it's also potentially having an impact. Maybe the progesterone, when it's elevated with it, balancing it out, does that have a counter effect on those
Yeah.
prostaglandins to prevent it?
So, okay, so then let's go into histamine too. So then, there's different pathways. So when we were going back to histamine, so histamine, estrogen is also something that actually will activate the mast cells. So there's estrogen receptors on the mast cells. So the mast cells will release histamine more when they're stimulated by estrogen, just like you were saying with the thyroid hormone. The other thing is that increased estrogen will also compromise diamine oxidase, which is what breaks down histamine. So we're estrogen's making there's a cyclical thing. So estrogen makes histamine go up, and then histamine can make more estrogen. We see this cycle happen. Then progesterone actually supports diamine oxidase. So when we have more progesterone, we're actually supporting diamine oxidase production that can break down histamine too. too. So that's another mechanism where we're saying, okay, we're these hormones together are creating this balance, and the balance is off. And that's actually one of the reasons where when the progesterone goes up during, so some people that have these regular migraines will actually have less during pregnancy. And that is because progesterone will go up, and actually that helps support the diamine oxidase, and that can make your migraines go down. So we're, looking at different dynamics when we're looking at this, but there's a lot of factors. So I think the big picture is to think, okay, what is your estrogen to progesterone ratio? And then when we're looking at estrogen, even if that's imbalanced, how are you metabolizing estrogen? And so sometimes whenever we're looking, so if you're going to get a blood test of estrogen, you're going to get your estradiol checked, and you're going to see that estradiol, and that number might still be low. You might not have high levels of estradiol, but if you're not metabolizing it, like if you have an upregulation of the CYP3A4 pathway, or it's not going down the correct pathway for elimination, then you could be hanging on to these estrogen metabolites and not actually eliminating the estrogen that you want. So you're kind of getting it around, making some of these symptoms happen.
Yeah. So like when I'm looking at hormones, I really want to look at both blood and the Dutch. I
Mm-hmm.
typically try and run them together. So I'll
Okay.
run estrone and estradiol in somebody who's still having a cycle.
Mm-hmm.
I want to see what both of those look like in the blood. Then I'll look at the
Yes.
Dutch and kind of compare those things. And for the listener, you might go, well, why do I need both? Well, because sometimes what you see on the Dutch test, you look at it and go, oh, I've got massive amounts of estrogen, right? On like at all these metabolites, they're all high. Like, and you think that, okay, I have excessive amounts of estrogen in the system. But if you looked at just the blood, you might say, oh, you don't have much estrogen. So
Mm-hmm.
those, you might get two different opinions as to what's going on sometimes if you only look at one or the other. Now, we don't always have the liberty of doing both because of finances and things, but I like to look at both. But I just looked at somebody's Dutch the other day where we looked at their estrogen levels and they're low in the blood. But if you look at their metabolites, if you look at the Dutch test, they're they're all pegging off the top of the chart. So what's going on, right? So this is a person who's getting a lot of aromatization occurring of their androgens at that tissue level, and now we're seeing these things. And so if you only looked at the estradiol and estrone in the blood, you wouldn't see that piece was occurring, right? And so this is a person
Yes.
who is having estrogen dominant symptoms, even though they have really low estrogen, right? Because of
Mm-hmm.
the metabolites that you talked about. And then the other thing that you talked about that's not on the blood is these phase 1 and phase 2 metabolites. So we're not looking at that in the blood, but you can see that on the Dutch, and it's that 16-OH metabolite that you were talking about before, which I believe is like the most potent of the
Mm-hmm.
of the first phase metabolites, and
Metabolites.
if that's the
Mm-hmm.
fat soluble form. So if you're not getting rid of that, and that's in circulation, that's the one that sometimes when people have more estrogen type high estrogen symptoms, you'll often see that elevate. I don't know if you see the same thing or not.
Exactly. Yeah, and that's where I think it's just hard for people because maybe they did get the that blood test, and they're like, well, my estrogen's low and I have all these symptoms, because we weren't looking at the metabolites. And that's why I want to make sure I agree with you about like checking both and seeing what the full picture is. But I do think particularly when we're looking at the headaches, it is good to have those metabolites because I often see that picture where you might, and I think everybody thinks that their estradiol is going to be high. Exactly what you said. Like, oh, it's estradiol, so you have high estrogen. And you're like, well, your body's actually, no, you don't, but you have a metabolite issue. And we need to move that metabolite and just be able to, the thing is, it's not hard to do. So I think that's another thing I want to mention, that some of these things feel like, oh, that's overwhelming, but we can make some simple changes, and we can get your body back in balance, and really just get that estrogen metabolizing well, and you feel so much better.
So, what are some of the clues that somebody might have a hormone driven headache, migraine versus say a GI based,
Hmm.
maybe
Yep.
primary
Yeah.
issue.
And so I would have to say, I'm gonna give that to you, but I would say just also, do have to say, I generally don't find it to be just one thing. So I generally find it to be a multitude of things. Now, there are a few people that come to me and say, I have hormonal migraines. We do the Dutch test, we get a few things, they feel amazing, they walk out the door, and there was just something small. That is the very minute part of the population. It's more a combination of factors. So it's one of those things that we're looking at all of the pieces, and it's when we put all of these pieces together that we start to see the resolution. I know I got off topic there, so
No, but I totally agree with that. Like we try and simplify it to like it's a hormone issue, but it's rarely ever a hormone issue. Just like when somebody says, well, what can you do to fix my thyroid? Well, your thyroid's probably not
yeah.
the issue per se. You have an immune issue, you have a micronutrient deficiency, you have an inflammatory process. Like you can't, and this is so important for the person who's coming to functional medicine. And this is why I say we have to be a jack of all trades or Jill of all trades, however you want to say it, right? So we're politically correct. If you're not looking at the big picture when somebody walks into, I'm sure in Meg's office or my office, and they say, I've got headaches and I want you to help me with my headaches and my thyroid and this. A lot of times people are thinking that these are unrelated conditions, right? And we're like, yeah, we want to know what your primary concerns are. We want to know what your number one goals are. But a good functional medicine practitioner is going to take a step back and like, don't care necessarily what the symptoms are and say, what's contributing to these things. So if you're going in and you've got like, I just want you to deal with my thyroid. Somebody says, okay, that's up to you. That's your choice. And you might think the clinician's going to work that way, but in my opinion, that's not functional medicine. That's really allopathic medicine with different medications or supplements.
Mhm.
If you go into somebody and they say, I only want you to fix my thyroid. Well, I can't, how am I going to do that? I can't only focus on your thyroid without knowing what's going on with your gut, your diet, your lifestyle, your nutrition, your sleep, your relationships, like everything else. Do you
Mhm.
agree with that?
Absolutely. Yes. It's all of those things. And that's it's the combination of all of those things that really start to create the symptoms that you're saying, whether it's the thyroid, whether it's the headaches, whether it's gut issues or anxiety or any of the symptoms that we're feeling, it's that combination. It's almost like someone would tell me one time, it's almost like you're moving like it's a sliding puzzle and you're putting all the pieces together and then they just click because we
Mhm.
get enough things in there that it's like, okay, the body is coming back into balance, the inflammation's down, all the things start to work and flow, and your nutrients are repleted, and we need to look at all of that together.
Yeah. And it's not like we're trying to ignore your primary concern. Like we talked about at the
Hmm.
start, if you got headaches or migraines, we want to do something to help you in
Start
the
move the
crisis
needle.
mode.
Hmm.
Yeah.
Yeah.
But ultimately, when we address the root issues, diet, nutrition, lifestyle, supplementation, breath work, all these kind of foundational things, just like you said, as we're working on these foundational things, a lot of times people are like, hey, these are getting better. This is getting better. This is
Hmm.
getting better. And they never saw the connection between their migraine and their gut. Well, why are my migraines getting better? Well, because you're getting healthier and you're able to manage these things a little bit better, right? So
Hmm.
that's really what functional medicine's about. But anyway, I want to get back to the question I
Yeah.
asked you that you,
Yes, which is what time? So most of the time it's when you're getting so when you get the migraines right around your period. So if you're either getting them like right before the bleed, during the bleed, or even like one in the middle of the month when you would ovulate,
Mhm.
generally that's when we're looking at a hormonal pattern. And people that have those know usually because it's like 2 days before my period every month I always get a migraine. So they're aware of that pattern, and that's where it's like they're coming in saying, I have hormonal migraines. Yes, hormones are a component of your migraines. Generally speaking, that's not the only component that we're looking at, so let's look at everything, and then we'll also balance the hormones and get your body back into balance.
Which is really important what Meg just said, right? Your hormones are a part of what's going on there, right? Because the tendency might be, okay, you have hormonal symptoms. We're going to put you on the pill, right? If
Mhm.
you have hormonal migraines, we'll just give you the pill. That may manage it. You should be good. Well, maybe, but you haven't addressed why those hormones were
Yes.
dysregulating, why it was creating it. Um, But one of the other things that I want to point out too is the estrogen. And when you talked about the histamine, we typically see histamine go up, or estrogen go up, histamine goes up. And so that then that histamine might be a potential trigger for the migraines, the estrogen and the prostaglandins and the vascularity that's going on. But another key piece is that both estrogen and the histamine need a certain pathway we call methylation, right? To
Yes.
be metabolized. So if I'm creating a lot more stuff to go through a pathway that may already be compromised, right? Due to micronutrient deficiencies, due to malabsorption issues, due to some degree polymorphisms, then you might be more likely to have these symptoms because you're just creating more chemicals that have to go through a shared pathway and you don't have the capacity to do that. Do you see that as well?
I do. And, I mean, when we're looking at the genetic patterns, we know that so many people in our population have the MTHFR genetic variants and different variations of genes in that path, in that histamine in the methylation pathways. And so getting that support, and everybody, that's another interesting, when we're talking about tests, the DNA test is another, like a genetic test is another
Mhm.
thing that people are interested in, but you don't have to have the genetic testing done. You can just actually, start doing something that actually start to help that pathway and see if those can make a big difference for you too.
Yeah. So I hear this a lot, like people like, I'm sensitive to methyl donors, and methyl donors are the thing that we utilize in this whole process called methylation. So do you see that people are sensitive to methyl donors? And when people are sensitive to methyl donors, is there any strategies you have to help them with methylation since they can't take these methylated vitamins?
So sometimes it's getting blocked at a different part of the pathway. So sometimes when you're looking at, if you can't take methylated folate, sometimes if a lot of people with the migraines will put on riboflavin. So you may have an MAO genetic variant. There may be other things, in different pathways. Like for example, when you're breaking down histamine, that you need to be able to go down the histamine pathway, and you may be speed so sometimes you're speeding it up at the beginning, and then but is it totally clearing out the full pathway? And so sometimes we have to look downstream, and riboflavin's another big one, where sometimes we'll do high doses of riboflavin to really be able to help them. That's one of the common supplements that we try with headaches to replete that nutrient.
Do you ever utilize creatine as a way to support methylation?
I do, yes. Yeah, it depends on the person.
So for the listener, it's interesting that this methylation process, which does lots of different chemistry reactions in the
Mhm.
body. Um, One of the things that we spent, I think the numbers 40% of methylation goes to make something called creatine in the body. And creatine is the phosphate donor that helps you make cellular energy. So one of the things that seems to be a helpful solution for some, and I'm not prescribing, make sure
Yes.
everybody's listening, so I'm not prescribing, but if 40% of methylation, if somebody's a person who's sensitive to taking B vitamins and methylated B vitamins, one of the ways that we might potentially be able to support their methylation pathways without giving them some of those things is to give them the end product of what they're using a lot of their own methyl donors to do, and that is
Mhm.
creatine. So for some people, that can be really beneficial. Again, that's not necessarily the strategy for everybody, but it can be beneficial. So definitely you want to, if you're, I don't know that you want to just do it from bro science, but you might want to work with a clinician, but that's a potential strategy. The other thing that, because I hear that a lot, people are like, I'm
Mhm.
reactive or I'm sensitive. Because you've got a bit more of a chemistry background here. We think about methyl donors as just supporting methylation, but my concern with somebody taking lots of methyl donors is there's a couple issues that concern me. One of those is that when we methylate genes, we actually turn off the replication of genes. Is that a potential with your chemistry background? could that be one reason why people who take a lot of methyl donors, like we acetylate the structure to kind of open up and let it unwind so we can
Mhm.
replicate it. But when a lot of these things we methylate and it keeps them tied up. Is it possible that when people are over consuming methyl donors, that they're actually turning down some of these mechanisms, not, unintentionally?
hmm I don't have data on it. I do. It is a possibility. I don't have data on the science behind that, and if that's. Have you done research on any like support of that?
I think it's the case to some degree,
hmm
but I don't have like a lot of study work on it. But that's one of the
hmm
thought process, because
Yeah.
if we acetylate things to open them up so we can do
hmm
replication, and we methylate things and shut it down so we don't have that genetic expression keep going,
Yes.
man, maybe that's part of the issue. I think the other part of the issue might be, especially if there's blocked methionine cycle
hmm
or transsulfuration cycle, is that uh, more methyl donors aren't really going to do what we want them to do because the pathway is
Absolutely.
blocked, and too much
hmm
sauce S-adenosine homocysteine typically goes back and inhibits methylation. So
Yes.
maybe that's one of the reasons why we're creating a bigger blockade of the drain of the pathway by just trying to
hmm
overload the system, which I think we have a tendency to do, right? If something
I
works
agree.
good, we think more
hmm
is better, and that's not
More.
always the case.
I don't do high levels of methylfolate, so I agree with you. I think I do think that's one of the. I feel like there's so many trends out there that are like, oh, this everybody has MTHFR, and yes, we're finding that a lot of people do, but everyone has that. I'm so worried. I have people come like, I have MTHFR, like it's like a disease that they
Mhm.
have, they have, and so that is out there, and then people are talking about like getting methylated folate, and I agree with you. Then you can be putting so too much of a good thing isn't always a good thing.
Yeah. So we've got about 10 minutes left. The time went real quick, as usually does, even though it's an hour and a half. But let's talk about, like, let's talk about strategy, because that's usually like the
Mhm.
way I like to finish up. So we know, a short summary: headaches, migraines, they're the result of something, right? Those are
Mhm.
the effect. So treating the symptom is just a band-aid. Ultimately, what we need to do is start to identify what's the cause. And it could be multiple things: foods or breathing. It could be dehydration. We talked about hormones. It could be infections. It could be a bunch of things. What would you say are like the top 3 or 4 things that somebody should consider if they're a person who struggles with chronic headaches or migraines or whatever we want to call them? What are like the top 3, 4 steps that they should engage in to try and identify and reduce these things?
Yeah. So we can absolutely do that. So the first two that are the super easy ones that you should start is what like we talked about, making sure that you're staying hydrated and making sure that you're sleeping. So that's another independent risk factor for headaches. And so if are you getting good sleep? Sometimes we actually have to put a mirror up in our own life. Like, are you really going to bed? If you're not going to bed, maybe you want to get things done at night. Maybe that's just like your own time, but are you actually getting good quality sleep? So those are just, lifestyle basics. And then we want to look at, I would say that I would print out a blank calendar and say, okay, take your blank calendar and look at the, have a month calendar. And then if you get a headache, again, so start looking at your patterns. So look at what time of the month it is. Look at your stress level. We didn't really get into stress, but that's another factor. So what were your stress levels? Were you anywhere different? What was your environment like at that time? Were you traveling? Were you home? Is it always on the weekend and when you're at your house versus when you're in the office? Or start looking at some of these patterns, because there's so many things that can be affecting you. And then also look at your food for, like I said, for the last 48 hours, and start to see, once you do that, if you start to see any of these patterns. Another thing you can do is add more magnesium rich foods in your diet. So magnesium is probably our most common nutrient depletion when it comes to headaches. And a lot of our soil at this point isn't as rich in magnesium as it used to be. So even adding some things like pumpkin seeds are one of our best source of magnesium. Just, some of the things that can enrich your diet. If I'm not, I like you, I don't like to recommend supplements because I don't know what anybody's history or if they should have them. So sometimes, we can add supplements of magnesium if you can't get enough through food, but that's just one of the most basic starting places that you can do to see if you're repleting that in your diet. You're looking for your triggers, you're looking for patterns, and start to see, okay, do I see any connections here?
Yeah, I think the calendar idea is a great idea for most people. You start because you
Mhm.
can start do some self-assessment. You can look at over a period of time. You can start to get a feel for, okay, what's the potential trigger? Whether you're going to work with a functional medicine practitioner or not work with a functional medicine practitioner, for you, it may be helpful, but it might be really helpful for the person you're asking to help you, because then we can,
Yeah.
that helps us really start to say, okay, wait a minute, what's going on here? Like every Tuesday, you're getting
Mhm.
a headache or a migraine. Like what's happening? Or it's every Sunday night, right? I'm getting a
Mhm.
headache. Wonder why. Like, what's the anticipated emotional
Mhm.
piece to that, right?
Even the environment. So, like, I had someone I was working with who was getting headaches on Sunday, and so we had to look into, like, okay, yeah, is it the stress for the week? Was it she was going to church every Sunday? So, was there something in the church that, we're looking at mold or environmental triggers or things like that that can also be contributing to some of these things. So, those patterns can really be helpful, especially like you're saying, if you have someone to guide you. The guide, it just makes it cuts through all of the guesswork. I know there's all this information out there, and sometimes people feel overwhelmed with, but this and this, I heard this, and I did that, and I did that. But sometimes, if you get that functional medicine guide that can just say, okay, we're really looking at it, we're going to streamline and put all these pieces together for you, it can make a big difference.
Yeah, it's probably a better idea to just jumping to whatever the headache product that somebody's selling or the migraine product that somebody's selling, because those are management tools. They're not correction tools.
Hmm.
So I think it's better. So I think you said you have a program, right? That
Yes, so
you
I
kind of
have a
use. So
program called
let's talk about
Headstrong.
that.
Yeah, so that is actually at this point, I used to do that with the group, but now it's just a self-guided program. So it's a great step. It has a lot of information. There's modules that you go through, there's workbooks, there's resources that really help you to guide you through to do all these steps that you need to do. And it's a great place to learn about an in-depth way to look at all the triggers that are and start to put the pieces together for yourself. And then I have a virtual practice, so I work with people one-on-one and really get to the root of this. And we've seen just hundreds of transformations. So, I just like to share the message that it's possible. That's, I think, when you've been dealing with this for a long time, it feels like, oh, this is just my life. It's not possible for me to make these changes. And it absolutely is.
Yeah, and I think that it's another thing for the listener. It's important. Like we talk about these things through the lens, right? So Dr. Meg's talking about headaches, and she's got the Headstrong program. But at the end of the day, these are things to kind of catch your attention to say, oh well, I have headaches, okay. But from our standpoint in functional medicine, whether you Meg had a headache program or probably a gut program or a whatever the symptom program is, would you say that foundationally, like you're still going to probably take somebody through very similar steps? What's going on? What's creating the stress response? What's creating this impact? Or would you say, no, every condition we have to be very specific?
Well, I would say in this both. So we're going to do a lot of the foundational pieces in this program, but
Mhm.
then we do have in it some things that are like in this program in particular, some things that are like very specific to headaches and migraines, just because there's it's like we're addressing that overall, but there's nuances that we're addressing in this program, like specifically for that condition.
Yeah. So you're not saying we're only going to consider these things without considering
Oh
all
yeah,
the,
absolutely.
right?
We have all the foundations in there too.
Yeah.
Hmm.
And I think that's really important because at the end of the day, your habits, your behaviors, your lifestyle, your beliefs, your thought process, all the things that I talk about in the book, The Thyroid Debacle, like the what we call the fitness factors are the things that if you're in a poor level of fitness in all those categories, you're probably going to have some kind of sign, symptom, condition, disorder. But if you have a high level of fitness in all those categories, the likelihood is if you improve your level of fitness in those categories, you're probably going to have less signs and symptoms, less problems, less disorders, less diseases, less challenges. So a lot of this stuff if is that we develop is the result of it's not probably not your genetic issue, but
Yes. Oh
probably
yes,
development
absolutely.
issue, right? So
Yes.
I think we got to wrap it up. Dr. Meg, I appreciate you coming on the Thyroid Answers podcast. I'll put the link to all the stuff that you sent me. So if somebody wants to go to the Headstrong program or they want to check out your website, but you also have a podcast as well. So you want to plug any of those things where people can
Yes.
find more about you?
Yeah, sure. I have a podcast called A Little Bit Healthier, and I'm also over on Instagram at Dr. Meg Mill, and I share a lot of tips over there too. So come check it out. I'd love to connect with you. I do free discovery calls if you have any questions. I'm just here to support you. So thank you so much for having me.
You got it. So it's great having you. For the listeners. If you like this episode, I think you go to wherever you do the comments on wherever you're getting your podcast from and give us like a star value. I think the one that you want is like 5, especially if Meg's on, right?
Yes,
The 5, yeah.
absolutely.
All right. So we'll wrap it up for today. Again, Dr. Meg, thank you so much for coming on the Thyroid Answers podcast and look forward to maybe getting you back on the podcast sometime in the future. Okay.
Yes, thank you so much for having me.